Good afternoon and almost noon, everyone. I hope everyone's having a good day so far. My name is Marco Giordano, and I am your CEO. And thank you all for joining us today. We are at a meaningful point in our response to the COVID-19 pandemic. In a few weeks, we will mark the 6-month point in our experience with this pandemic, with an understanding that several more months of embracing our new normal lie ahead. During the past several months, we've provided this forum and other opportunities for staff to gather and share information and experiences, as well as to hear your questions, your ideas, and your challenges. And as a result, together, we have responded to a pandemic quickly and successfully, but not without challenges and struggles, and sometimes fear and uncertainty. At RHD, our values of multi-level thinking, creativity, diversity and inclusion, and empowerment of groups urge us to hear, understand, and utilize the voices of the larger group in order to accomplish what lies ahead. As we continue to embrace this new normal, we must also review our response with feedback and partnership with those staff on the front lines and adjust to ensure our success and ability to sustain our efforts and continue to have better outcomes. So today, I'm urging all of you to continue to use your voice or the voice of your team or group to inform our next steps. Please use this forum or your team or group meetings to raise questions, to share ideas and observations. You can also share your thoughts via email to rhd_COVID_19@rhd.org or through our anonymous suggestion box, Your Voice, which is accessible via myrhd.org. Your voice is critical to the work we do. Your voice is a reflection of our values and how we approach our work on a daily basis. So I encourage all of you to use it in order to drive and help us determine what our next steps need to be as we continue to respond to this pandemic. So I'm going to leave you today with a little bit of a sneak peek of one of our rejuvenated values. I think everybody is probably somewhat aware of our rejuvenation initiative of our values that has been in front of us for a period of time, and that has come to an end, and more information on that will be released to you all over the upcoming days. But I want to leave you with a sneak peek. And that sneak peek is our value of empowerment of groups. At RHD, power resides with the group, not with the individual. Whenever possible, decision-making should utilize the collective thinking of multiple individuals at various levels within the organization, including the people we support. All employees are expected to create and foster safe spaces to others to offer ideas. Leaders are expected to empower and encourage others to make decisions with group input. At times, the leader or leaders of a group may need to make a final decision, but this should incorporate group input whenever possible. And no individual should exercise arbitrary power over another. So I ask you to really live our value of empowerment of groups, to really join us by raising questions, by contributing ideas and thoughts to our response to the COVID-19 pandemic. So that way together we can make sure that we're addressing all the needs of all of our staff and the folks we support as we continue down this path together. So as I said, more information relating to our rejuvenated values will be coming out to you all in the next few days. So look out for that. And with that, I want to thank you all for what you do each and every day. And I thank you all for joining us today for hopefully some good conversation. Sean?
Thank you, Marco. Hello again, everyone. It's typical that during the start of this town hall, I provide some guidance on how you can actively participate. At this moment, I'm going to share my screen so that I can review some information as it relates to how you can participate. This is an open forum, and during the call, all lines are muted. However, during the Q&A, you will have an opportunity to participate in this process. And in order to participate, there are a couple of ways in which you can do that. You can send questions to your voice. That link is presented there on the screen. You can also send in questions to the COVID-19 inbox, and that address is listed on the screen as well. During our question and answer period, you can also submit your questions through the chat feature, and we will route those questions to the appropriate leadership. And then finally, you have the option also to raise your hand within the process. As a friendly reminder, all lines are muted during the call, and then we will open the lines when it is time to do our question and answer period. At this time, I'd like to pass the mic to June, who will do statistics. June?
Thank you, Sean. Good afternoon, everyone. I'm June Hodges, Director of Risk Management. I've been asked to share our COVID-19 statistics. Currently at RHD, we've been lucky with our numbers, and that's due to all the hard work of our community members and their adherence to COVID protocols we've set in place. We've managed to experience decreases in COVID reported incidents from week to week the last couple months. However, last week we saw an increase in our weekly report submissions. We had been averaging 10 reports per week, but last week we had 34, and specifically 10 of those reports were for confirmed COVID cases. Our consolidated data is as follows. Confirmed cases, 286, negative 407, and suspected 61, and possible exposure 72. Please remember to continue to send updates on previously reported COVID incidents so we can conclude on the suspected and possible exposures. Send to safety@rhd.org. Finally, I urge you all to adhere to our visitor and employee protocols, as these measures will enable RHD to keep its clients, staff, and communities safe during this pandemic. Thank you. Now, Sean Mott will continue with our town hall program.
Thank you very much, June. At this time, I'd like to pass the mic to Deanna, who will speak with us about our hazard pay. Deanna?
Good morning or good afternoon, everybody. Thanks for joining us. I hope everybody is doing well. I am here to make everybody aware that we are extending our hazard pay to September 30th. Instead of doing it monthly, which is what we've done in the past, we're going to be extending it on a quarterly basis now. So by September 30th, you'll hear about an extension to the end of the year. And this hazard pay is separate from any state grants that we have gotten. So this is what has traditionally been RHD's hazard pay since early on in COVID. And this will be continuing till September 30th. Before I get off, I want to say thank you to everybody for all your hard work. And Marco, the countdown to 6 months. I had not realized we were so close. I pass the mic over to Bernie.
Thank you, Deanna. Hello, everyone. I'm Bernie Glavin. I'm an EVP in our IDD division. Over the last several weeks, Sean Mott from OD, Brian McHale, our safety director from risk management, myself, have met several times, and we are trying to look big picture at the COVID pandemic and our efforts. And again, I want to echo what Marco, June, Sean, and Deanna said, and thank folks for all the hard work. The numbers aren't staying where they are, even though there's been a recent increase. We've not been as successful as we've been without the hard work of everybody on this call and everyone else. So we really do appreciate it. And it's a great segue that, 6 months, I had not put that together. What I had jotted down was, we know it's going and going and going, long past the time that any of us thought it would go. It's stretching into our summer, our vacation time, our barbecue, our picnics, our outings, our amusement parks, all those congregate activities that we do outside on a regular basis and that we all look forward to it. So Sean and Brian and I got together and thought that we might want to look at this information from just a little bit of a different angle, okay? So we're hoping that over the town hall meetings, over the next 3 or 4 town hall meetings, that you'll be gracious enough to allow us a couple minutes of your time. And we want to talk about, and hopefully it will be that, it won't be a lecture, it will be talking about some conversation going back and forth about outings, about activities, about protocols, about safety levels, and about the options that we have. To kind of reinforce what Marco said earlier about empowerment of groups. We've got greatly creative people. I know Leah Forrest has sent out some really nice, safe activities. I know Mark Leonard has sent stuff out. I know we've gotten stuff from folks in the central part of our organization. So we really want to encourage folks to look for those creative ideas. And if you are doing something that's creative, please share that with us, okay? So what we did is last week, we were trying to get a barometer on how safe we think we are behaving and acting, in addition to the data that Brian and June share with us on a every 2-week basis. So what we did is last week, we sent out a survey to all of our employees through RHD email. Hopefully you got it, you got a chance to complete it. It had 10 questions, and there was a drop down in each question depending on your answer, okay? The goal of that was really to try to figure out where we as an organization from an activity level fall in a scale. So we looked at a scale that rated activities. It had 37 different activities. It was published by a medical association that I'm not going to tell you which one, because we'll talk later about some future quizzes that we're going to come up with. So I don't want to give away the answers. But we looked at a scale that was published by a statewide medical association that listed 37 activities and that scored those activities either low risk, moderate risk, or high risk. So what we were wanting to do is have people answer the questions so we would have data. But before I pass it on to Sean, who has the data, we wanted to ask folks to think, what do you think the answer will be? Do you think RHD as a whole, with our activity levels over the last couple weeks, have functioned in a low level of risk, a moderate level of risk, or a high level of risk? So Sean, jump in. I think this is a point where we're going to ask people to use the chat room to put that in. Is that right?
Yes, that's correct, Bernie. And what I'm going to do to create a visual for what Bernie has just shared, I'm going to share my screen so that, excuse me, frog in my throat. Don't know how that frog got there. Going to share my screen. I guess it would help if I did this in a way that I look like I know what I'm doing here. All right. You like the way I stall by talking, so you think that I'm doing something? Okay, there we go. So as Bernie mentioned, all right. And if you could see my screen, if you could just give me a thumbs up. Oh, cool beans. I guess I should have been more specific. If you can see a colorful graph on my screen, give me a thumbs up. Awesome. So as Bernie mentioned, there are a series of things that we do that fall somewhere on a continuum as it relates to if it's a low risk activity or moderate low risk activity or moderate risk activity. And so what you see on your screen right now are the different activities that people typically do throughout the course of the day or the week that are categorized by risk level. So you'll see something like playing tennis or going camping is identified as a low risk. However, something like working out at a gym or going to an amusement park is rated as a high risk as it relates to COVID-19 and the possibility of transmission of the virus. So as Bernie mentioned, we did a poll. We just wanted to try to understand, where are our coworkers? Where are our employees as it relates to the various activities that they participate in, so that we can get a baseline to understand where we are as an organization. Before I showed the results from that poll, which there were 320 employees who actually completed, wanted to get your quick assessment. So where do you think we landed as an organization? Of the 320 people that completed the survey, do you think the majority of them are at low risk? Do you think we're at moderate to low? Where do you think we are? And for the first 3 individuals with the correct response that's put into chat, you will get this limited edition face mask. To the side for effect. So I'm going to check my chat now to see where we are. Okay. Oh my goodness, we got a lot going on here. So chat, what do I do? Okay, there. All right. Oh, heavens.
Sean, I've not seen the data, so I responded, but I don't think I should be included in the possibility for the prize, just saying.
Understood. So we have Peg that selected moderate. We had Tara at moderate to high by Kristen. So we got quite a few responses there. What I'm going to do is, because I realize I'm trying to do multiple things at one time, Sarah Reed, if you would be so kind as to, when I reveal the results, if you could let me know that order of like those first 3 individuals that answer correctly, and I will ensure that they get a mask. Okay, drum roll, please. Oh, I love the sound effects. Okay. And I drum rolled only to put it at that one. Okay. Heavens to Betsy, this worked so much better when I was practicing. All right. Doo-doo-doo. I appreciate your patience, and as I stumble through this, I'm usually a lot more organized than this. I have a newfound appreciation for managing this process. All right, let's do that. Okay, so still a stop share and then a share. I guess the suspense has got to be overwhelming for you. You're probably sitting there and wondering, wow, show the results already, Sean Mott. Like, so
It's a great build-up, Sean.
Exactly. It's an excellent build-up, because you're now like wondering, and imagine what would happen if I can't do this. Like if I struggle to the point where I can't do, you're like really gonna be really upset with me. Like, oh my goodness, that's Sean. I can't believe he just did that. Oh fudge. Oh, I was hitting the wrong button. Jeez Louise. Okay. And it's not advancing. All right, let's try one more thing. Again, I am terribly sorry. Let's see.
As Sean is getting us positioned, those of you that answered moderate, that's actually not a full answer.
Oh, nice, Marco, nice. It's not showing my percentages.
So, Sean, maybe we'll trust you, Sean. You could read it to us.
I like your way of thinking. So let's do this.
And then maybe, Sean, you could send it out to everybody later, just to verify that you're not being, slanted.
That's a really good point, Bernie. Thank you very much. All right. So yes, Bernie, thank you very much. So we had 8% of our respondents who participate in activities that are low risk. We had 62% of our respondents who are at a moderate to low risk. We have 45% of our respondents who are at a moderate risk. And then we have 27.5% of our respondents who are at a moderate to high risk. And then we had 8.4% of our respondents who are at a high risk. So with that percentage, just want to check in at this point to get your thinking on how we landed as an organization. So when you hear those numbers, what comes to mind as it relates to where we are? So if you want to put that in chat, or if I can start to unmute lines now. Sarah, could you unmute lines?
Sean, could you go through the numbers one more time for us?
Sure.
And this is what you're giving us is numbers based on the responses we got from the poll, right?
That is correct, Bernie. So
okay.
These are the responses from the poll. And out of the 320 individuals that responded to the poll, 8.3% were responded on the activity that's at low risk. 62% is a moderate to low risk. 45% is a moderate risk. And then 27.5% at a moderate to high risk. And then 8% at a high risk.
So Sean, may I ask the first question?
Sure.
And then this just shows we're doing this live. That adds up to more than 100%, so I'm a little confused.
That is a good question, Bernie. My percentages may be slightly off, and I'm thinking what I may have done wrong to manage those percentages. And let me look at, I'm just going to pull up one more chart.
So
That
Sean,
represents, yeah, go ahead, Bernie.
I was going to say, while you're doing this, even if the percentages are a little off, I think it's clear that the bigger numbers are going to be the bigger numbers, right? So the lowest amount is going to be at the very low end and at the very high end. The largest amount of response are going to be in the moderate to low. Next would be moderate, next would be medium to high. So the vast majority would be in those three categories, the low to moderate, the moderate to high. That would cover the vast majority of our responses. And I think that really is the main thing we need from this.
And so understanding that my kind of management of the accurate numbers is slightly off, which I do understand affects the level of credibility. But like Bernie said, the majority is within the right lane. Just want to get some thinking as to your thoughts about where we landed as relates to that distribution across the board.
Sean, there's been a lot of responses in the comment section, in the chat room, I'm sorry.
Yep, and looking at now, so some could say yes to a moderate low and a yes to a moderate high, etc. Okay, just looking at some other responses. One of the responses looks at the fact that some people probably engage in more than one level of risky activity. So across the continuum, so that could be a dynamic where you can participate in more than one of the risky behaviors, or the behaviors more than one of the activities. Someone said that these numbers are exactly what I expected. So my next question to you, and just having this at a very high level, what does it mean to have this information? Like, for example, we know that this scale presents a continuum. So from low risk behaviors to high risk behaviors. What does it mean that we might have a pulse on how we are as an organization as it relates to the type of behaviors that we're participating in? What might that mean to you? And I'm trolling the chat now to see what responses are. Okay, so another question.
So there's a response.
Yeah, so I see one that says that perhaps we should stay home as long as possible. I am curious about the recent spike. Was it limited to a program, a state? And that looks like it might be a question that's looking at a spike that we reported that June mentioned. And June, in your reporting of your statistics, did you convey that there was a spike within our numbers? And if so, was that pertaining to a particular location? And you're on mute, and I will unmute you.
So Sean, if June is having some technical issues, I can jump in,
Yeah.
because if you remember, you, Brian, and I had this conversation in our last meeting where Brian reported that there was a spike in the last reporting period of people that had been exposed, and that many of it was from people who were going on vacation, and they had gone on vacation to, what folks are designated as hotspots. People were going to the beaches. They were going to North Carolina. We had some folks go to Florida, and potential exposures. And then when they came back and told us about it, the protocol called for them to have to, either quarantine for 14 days and make sure they're symptom free for a couple days as per the protocol, or to try to get a test and let us know if they get a negative reaction. So it was vacation activities that Brian saw was the new anomaly in the last reporting period.
And so the question to the organization as well, and just a couple more questions. Is it helpful knowing that there are some activities that you can do that are low risk, and that there are some that are high, as well as some at moderate? And I'm checking for us. So I have a response. Yes, I saw a sign at my doctor's office that said practice social distancing, not medical distancing. Going to a doctor's is important. Yeah, and so the dynamic is there's some activities that we just have to do that are just regular part of our daily operations and things that we do. Yes, I think this helps as well. Yeah. And I think that—
So the goal in us doing this, I'm sorry for interrupting, Sean, the goal in us doing this is to spurs people thinking, okay? Thinking about what activity we can do. And again, we don't want to just sit here and say, you can't do this, you can't do that, you can't do the other thing, because that's really not very helpful as we pass the 6-month mark. So we're really trying to reinforce that Leah, that Mark, that others are putting out lists of different kinds of activities. And we're asking folks, going back to the empowerment of groups that Marco referenced earlier, we're asking folks to give us some ideas, share ideas that you have for activities, safe activities that you have done, because we understand that, people don't want to just be in the house all the time. I do, as a side, really want to reinforce, over the last 2 or 3 days, I've heard commercials from several different medical associations around the country encouraging people to be COVID vigilant, be COVID safe, but if you need to go to the doctor, please go to the doctor. Just practice with masks and social distancing and things like that. Don't skip an important doctor's appointment because you're afraid to go. That was my commercial.
Thank you, Bernie. And one of the other things that we were hoping as an output of just this sort of quick activity was to also hear from our colleagues. This is just a small listing of a variety of things that we're doing throughout the day. And some of these things are things that we do because they are sort of chores that we want to get done. But then some things are a way in which we stay connected to the people that we care about, or staying active. And I noticed in the chat, there were a few recommendations as to doing some activities that might be low risk. So what Bernie, Brian, and myself will do for the next 2 town halls, which I would admit will be with a greater level of efficiency, is to present the other categories within this listing, because it's a long listing of different activities that are on a scale. And we will look at ways in which to engage you in a creative way to kind of share information and to gather your thoughts. With that said, and Bernie, did you have any closing comments?
Yeah, I would do 2 other things. One is
Yes.
that I saw a question that Peg put in there about her being surprised that the plane was moderate, and I am too. And to be honest with you, I think it really depends on the point in time that the risk assessment was done. Was that done when most of the plane was empty, as opposed to now where planes are filling up? So in addition to using the scale that we have, Brian and Sean and I will continue to research other similar scales from reputable associations and blend those and take in consideration the time at which the scales were completed. Okay. Going forward, Sean, is this a place I should talk about where we're going to go with this?
Yes, Bernie, that'd be great.
Okay, thank you. So going forward, like I said, when we open, we want to be part of this meeting for the next 3 or 4 meetings. We will send out, once or twice a week between now and the next meeting, we'll send some small quizzes out and ask folks to take the quiz to respond. When we get the responses back, we will put all of the right answers in an RHD baseball cap. We will draw out a couple winners for each of the questions, and they will get to sport, a lovely mask like Sean has on today, either some PPE or some RHD bling. So we will have some prizes. And just to keep everybody in suspense, our plan is to send them out, maybe twice a week, and then announce the winners at the next town hall meeting.
Thank you, Bernie. Appreciate that. And thank you all for your patience as well as participating in that activity to look at what we're doing as an organization as relates to different activities and on that risk continuum scale. We're going to now shift, and this is a typical part of our town hall calls where we open the lines to field questions that you may have. We had our introduction from Marco. We had June, who talked about statistics. We also had Deanna, who provided information regarding hazard pay. And so in addition to those topical areas, there might be other questions that you might have. So at this point, we're going to look at the chat feature, as well as if you'd like to raise your hand, or even if you'd like to speak, we're opening the lines to questions so that we can field those questions.
Sean, I'll start with a question.
Yep.
If folks have ideas for activities that they've done, where would we ask them to send those ideas so that we can share them out?
Sure. I think the COVID email box address would be a great place because that's a centralized location. It helps to already categorize our information because it's COVID related. So sending it to the email address would be an ideal place to send your thoughts.
Great. Thank you, Sean.
So we have a question that's regarding a risk level, and this is regarding the work that we do. I'll read the question out. I think transporting our clients in a company or personal car is our biggest risk for our clients. And I'm sorry that. And the question is looking at what is the risk level of transporting our clients in a company car? June, is that an answer? Yes, thank you, June. Oh, yep.
Going back, okay. Yeah, we did develop some vehicle protocols that we sent out to all programs recently on how to transport clients safely during the pandemic. So you would want to refer to those, but really it's wearing masks, making sure that the surfaces inside the car are cleaned with the appropriate cleaning materials, wipes, microban, whatever you have available for that to disinfect, between transportation events, and then just making sure that you're not overcrowding a vehicle. Really should, in a van, only have 2 clients, 1 in each seat section with masks, and also offering hand sanitizer or masks to those people you're transporting who don't have it, and then so keeping that in the vehicle, and then cleaning the vehicle thoroughly after use each time. Cracking the windows for ventilation. Do not use the air circulation button, because that's putting the air from the back to the front, and maybe distributing some aerosolized COVID virus, which you don't want to do. So those are really the things that you can think about. If you have to stop for gas, remember to either put gloves on to push the buttons, or to use hand sanitizer when you get back in the vehicle, so you're not spreading anything that could have been on the push buttons of the gas station tank.
Thank you, Jen. I have another question that has come through the chat. I'm getting calls from our DSPs concerning pandemic pay. Is there any information you can share concerning this? And as it's regarding pay, I'm thinking, go ahead, Deanna.
Yeah. So What I think people are asking about is the grant that Ann referenced that we applied for. We have not received conclusion on whether or not we are getting that. So that is still open. And if there are grants in different states other than Pennsylvania, today, as I sit in front of you, I am not aware of them having been approved either. So pandemic pay is something that is hopefully coming on the horizon. We are going to continue our RHD hazard pay for everybody as RHD. I hope that answers the question.
Thank you, Deanna.
You're welcome.
We have another question, and it's regarding a recent communication, I believe nationally, and it's regarding payroll tax. Will we have the option to not have our payroll tax deferred if that order goes through?
So we've already, I can't see the question if it's in the chat, but we have already elected to defer as much of our payroll taxes as we can as an organization because it assists us with cash flow. Right now, the deferred payroll taxes would be due back in two payments, one in December 31st, 2021, and the other in 2022. I know that according to the news this morning, our president signed an executive order over the weekend that further impacts payroll taxes, but that order is not in place to my knowledge, that there is questions if that was even something legally that he could do. So we are taking advantage of what we know today because it helps us, and I hope that answers the question. Thank you.
Thank you, Deanna. This question is pertaining to the office space at 4700. With employees going into the office to pack up their desk, how often are the hand sanitizer dispensers being filled? I noticed that a few were empty when I was there. I believe that's a question, perhaps June? Yes, June.
Yes, the facilities folks check that daily. They are filled when depleted. So I will also check up with them this week to make sure that's currently being done. But when I've been in there each week, they all have some sanitizer in them. So, but we can double check.
Great. And June, I am assuming that once you do your follow-up, that is a clarification as to the process again would go out in our communication that goes out at the town hall where sort of we could talk to the hand sanitizers or to make that note. Is that assumption correct?
Yeah, it
Yes,
is part of the facilities crew. They check that daily. So
thank you, June. Sarah, I noticed that there are no additional questions in the chat feature. Just checking with you to see if we received any additional questions through our other mediums.
No, we have not.
Great, thank you, Sarah. And just keep the line open to see if there was any additional questions via chat or through the COVID inbox or your voice.
If I can, Sean, while
Yes, Marco.
while we're waiting, I just, the question that was posed earlier around payroll taxes, and Deanna, please correct me if I'm wrong, but the opportunity that Deanna spoke to thus far has been around the employer portion of taxes, not the employee portion. So the employee portion continues to be withheld from paychecks and continues to be deposited with the federal government as we always have. What the president, I think, is proposing through his executive order that there would be some reduction in employee payroll taxes or some deferring of employee payroll taxes. As Deanna said, that is just thoughts right now in front of us that the president has shared, not any real action or understanding that we can take action on at this moment in time.
Thank you, Marco. We received an additional question in the chat, and this is pertaining to electronic signatures. As we, as a corporation, moving towards are we as an organization moving towards any form of electronic signature documentation management system, such as DocuSign or some other option? I know that we have made a particular shift like this within HR, where we're moving to ways in which to sign. So see if Alicia would like to answer this
Sean, I got
question.
it.
And then, oh yes, go. Oh, okay.
Melissa, I saw the questions for you and Sean. We are using Adobe for capturing electronic signatures. If you are somebody who regularly needs to sign it, please reach out to IT purchasing and request the paid version of Adobe.
And from somebody who signs a lot of documents, it is a wonderful tool.
Thank you, Tara, and thank you, Marco, for that commentary. We have another question in the chat box. How often should PPE supplies be replenished to staff? Perhaps a June question? Yes, June.
We've been sending regular information out to the programs regarding their inventory of PPE. There should be a 3-month supply at every program. Staff should have PPE regularly available. If they don't, please check with your supervisor immediately. So there should be no reason anybody is going without PPE.
Thank you, Jen. It appears that we have a follow-up question. So a recent question was looking at our electronic signature documentation management, and it looks as if there was a question about what if we have clients who need to sign. I'm wondering if there's someone from the program
Sean, I
that
have
can
it.
present it. Yes. Oh, thank you.
We can use Adobe for client signatures as well. It's set up very similar to DocuSign, where you're marking where the signature happens. It gets emailed to them if that's the most appropriate way. If it's being done electronically, I'm going to assume we can email them the documents. But if anybody has a specific case they're concerned about, please reach out to me via email. I'll be happy to help you through.
Awesome. Thank you, Tara. Is there any plan for getting mail to staff who are not working at the office during COVID? And I'm assuming this question is pertaining to mail that's delivered to 4700 and then getting that mail rerouted to individuals who are not working in the office.
I would say that that's a plan you should be working out with your direct supervisor of what the plan is for getting the correspondence that you need. I know most people have been working with their teams to figure out the process for getting their mail to each other.
Thank you, Tara. Have a follow-up regarding the hand sanitizers at the 4700 location. And we got confirmation from Sean Thomas, the facilities director, that the hand sanitizers are checked daily and then filled when needed. And I'm now scrolling for additional questions in the chat. So this is a question regarding hazard pay. For clarification, does the hazard pay begin when a client has symptoms or not until they are confirmed positive case? The release protocol seems to differ on that.
When a client has been exposed to COVID, a known exposure and or has COVID, the employee should be receiving hazard pay.
Thank you, Deanna. How do we handle people in the office who are not wearing masks after constant request? Thoughts from our leadership regarding that particular question? And I know that this question has been presented before in the past.
So it looks
June
like
is
June wants to
trying.
respond.
Oh, June. Oh, yes.
She's
Yes,
definitely
June.
trying.
Yeah, thank you, June.
She's raised both hands.
I know that the DSIC team has been really successful with several cases where clients have not wanted to wear the PPE. So you may want to bring them into the situation to see what thoughts they have and making any recommendations.
I'm assuming that question was probably, I'm sorry, Sean.
Okay.
I'm assuming that question was probably more directed to staff, not folks that we support. And again, as we all embrace the environments that we work in, our values, respect for the dignity and worth of each and every one of us, the response to the question, although maybe a challenge at times, is simply it needs to be addressed head on directly with their supervisor, and then continuing to address it until we see the appropriate action. We should not, any one of us, allow folks to disregard our protocols during COVID. They're there for a purpose, the purpose of keeping us all safe and well, and we need to hold each other accountable to that.
Thank you, Marco, for that follow-up regarding that question. We're revisiting the hazard pay, and this is a follow-up to what Deanna mentioned. Deanna mentioned clients being exposed. Does hazard pay include coworkers being exposed as well?
Yeah, I'm going to ask June to back me on this one to make sure I'm right. But the hazard pay is for our employees who are working and caring for the individuals we serve. Mm-hmm. So if a coworker comes to work, it's not related to caring for the consumer. But June, she's waving her hand, so and I'm looking over here where I can see her.
Yeah, if someone, first of all, temperatures should be taken before people come to work. They're supposed to be logging. Hopefully they're not coming to work with 100.4 degree temperature, which is one of the symptoms, or any other COVID symptoms, because then we have a series of questions that are supposed to be asked. So given that, though, if someone is still sick at work, they should be sent home, and quarantine period would start for them. So therefore, that nobody else would have exposure to that person or have to work with them at that point on. Again, if someone's not reporting they're sick, that's a situation for discussion with your supervisor, because that's putting everybody at risk.
And just because we've mentioned it, I video muted myself so you could see my phrase, love your neighbor, wear a mask. It's important, please.
Thank you, Deanna. And I'm just scrolling the chat to see if there were any questions that have come in. And then I'm also going to check with my colleague, Sarah, to see if there are other mediums, if we received any additional questions. Sarah?
No, Sean, just the chat.
Great. Thank you, Sarah.
There wasn't, I'm sorry. I saw a question around city wage taxes that I don't know if we answered.
And Deanna, if you could present that question, and then we can, so we'll have the full question and then we can.
Can we change our location? Can we change our location to pay, less taxes now? I live outside the city, was the question. And when we first entered into COVID, I don't know if Alicia is still on the call. I can't see her waving her hands anywhere. When we first entered COVID, I think I heard her. Or not. We thought COVID was temporary, so we did not update this in our system. And this question came up last week again, and I think that is still the answer, but would leave it to Alicia to clarify either at the next town hall or somewhere, since I don't see her on the call anymore.
I'm here. I just was having a hard time getting off of mute. I don't know if somebody unmuted me and I unmuted myself at the same time. Anyway, Deanna's right. So when COVID first began, we had no way of knowing, we still have no way really of knowing how long this will last. And so any employee who lives outside of the city can either fill out that paperwork and not have their taxes taken out, or can file for that return at the end of the year. Most people file for that return at the end of the year, especially if they work, if it's not a consistent assignment. So at this time, we are still right now, because COVID is still up in the air, have not gone through the whole process of changing everything in our system, only to come right back and change it right back in a month or 2 months, or whoever knows when we're going to be coming back in. As soon as we know what the plan is for shared services for Philadelphia, we'll be able to know, because that's where most of the questions are coming from in terms of whether or not the corporation is going to be changing our systems and go through the process of changing our entire systems to recalculate pay. You individually as an employee have the right to be able to come in, complete your paperwork, and have that changed. You will be responsible for any missed taxes, should that be something that changes. Again, the rule for the city of Philadelphia is not that you choose to work from home, but the employer requires you. And so again, COVID was that situation. We didn't know how long it was going to last. And so I think the closer we get to coming up with a final understanding of what our return is going to look like. And again, I'm primarily speaking to people at 4700 Wissahickon in Philadelphia. Most other people, or if they live outside and they're working outside of the area they live in, their taxes are done based on their address that they work from. So again, we are not, is my understanding, and Marco can confirm, even the return plan does not have anyone from shared services, at least, working 100% permanently from home. So again, that's, I see you nodding, that is exactly the same challenge that we have, is that even in the return, no one's working 100% remote. And so we're not, and I've heard that being asked, well, we're now required to permanently work from home. That has not yet been established. And my understanding is that is not the long-term plan. So just wanted to kind of put that out there. Yes, someone from the corporation does need to sign off. I see Kristen, I'm just jumping ahead, Sean just answered rather than you go back, read it, and answer it again. Deal with the mute, unmute. Yes, someone will definitely have to someone from your supervisor, manager has to sign off on it. As far as the divisions working 100% from home, that is the first time I'm hearing of that, Mandy, and so we'll have to have that conversation. Unfortunately, that's not a conversation that was had with myself, so that I could help to prepare for that. We could plan for that. So we will have to get that information and make sure that we follow up, I guess, with whoever in the division has made that decision. But that was news to me, so I couldn't answer that. So if there's someone from the division wants to step into that, I think maybe that's a separate offline conversation, and maybe don't need to take up this space here to do that. But I would encourage that there be some inclusion of the teams and the systems that are responsible for those things in those conversations around those decisions.
You know, we have an all-staff town hall tomorrow regarding the admin space. I think that could be a great question that we can cover during that session tomorrow.
Thank you, Marco. And thank you, Alicia. Alicia, did you have an additional follow-up? One more? Yes. Okay. We can unmute Alicia.
Sorry, I was too quick to mute.
No.
I would ask, though, that if divisions have sent a different message than the one Marco has been sending, that information please come forth before the meeting tomorrow. Otherwise, we will not be able to answer and speak to that tomorrow. So if whoever from the divisions are making these decisions and have therefore gone about informing your staff, I'm not sure who that is. If someone could connect with me, that would be absolutely phenomenal. I would very much appreciate that. Thank you. Thank you, Shana.
Thank you, Alicia. We have a follow-up question as it relates to temperature taking. Are we relying on temperature checks to determine whether or not an employee is able to work? Evidence shows people can be asymptomatic and spread the virus just as much as someone with a confirmed case. Thank you, Jen. You want to go ahead and respond to that question? You can unmute your line. Stephanie is going to answer the question. We can unmute her line.
Okay.
Go ahead, Jen.
Yeah, so temperature taking is only one of the tools. I answered that on the chat, but only one of the tools we have in our toolbox to keep the work environment COVID-free. You wear a mask, you wash your hands, you social distance, all of these things together. It's just not one thing you can do, but they all help to decrease the transmission of COVID-19.
Thank you, Jen. And I see Stephanie nodded, so I'm assuming that is an indication that you didn't have a follow-up for that. Thank you.
June shared that quite well, but we also just want to add in terms of the physical symptoms, and I know it's been a while, don't forget we do still have that list of physical symptoms as well as the travel questions that seem to fluctuate day to day in terms of where you shouldn't go and what are hot spots. So yes, we are using temperature, but not temperature alone. Thanks, June. You got it.
Thank you, Jen. Thank you, Stephanie. And I'm just familiarizing myself with this question. I know it's Jen's response, okay? So next question, the division has been asked to come and collect all our personal items and anything we need to continue to do our job from home. That seems to give the impression we are working 100% from home. And Alicia, I'm going to unmute Alicia's line.
So I actually just got a couple of direct chats that really helped to clarify. Yes, that people have been asked to come move their belongings so that the office can be arranged. But I also have another individual in BHH saying that that was all that was asked. No one said that they were be giving 100% remote work. So it definitely sounds like some clarity within the division to make sure that there's some clear messaging happening, because it seems like within the division there's some confusion about, or maybe even some inferences to what something means. So again, what was asked was employees needed to share specific desks or touchdown spots, so on and so forth, but to move your belongings did not mean you were working permanently from home. If you have a specific individual then arrangement, then that's something that we need to talk about. So again, I think it's a conversation we need to follow up. I guess we'll have to wait for Linda and Laura to get back from vacation, since, or specifically Linda as the person who's the head of that division.
Thank you, Alicia. And Stephanie, did you have your hand raised too also?
Yes, just in case there is a mix-up, we've got two separate things going on. So there is the work from home that is occurring because of COVID-19, right? So some of us are home and don't come in at all because of COVID-19. Some of us are being affected by the administrative space initiative. On that, I would share that it is my understanding that almost everybody, with very few specific and talked out exceptions where they've talked with their supervisor, will be spending at least part of their work time over the course of any month in the office. There are very few people who used to come to 4700 and never will again. There will be an expectation based on what you've worked out with your supervisor. So I just wanted to share that, and also understand that the population of people who are working from home, and hopefully some of you are 100% from home, that is related to COVID-19 versus the more permanent work from home arrangement that you've talked with your supervisor and teammates about.
Thank you, Stephanie.
If I could
yes,
just add
on
to that in terms of, again, our intention is to continue to have the benefits of our community space, the benefits we get from the collaborative space that we have at 4700, and to have all folks benefit from that. And so our vision is that while there will be a percentage of folks that work a significant amount of time from home, that the expectation is that there will be opportunities and needs to come into the office for various kinds of activities, for staff meetings, for group discussions, and for other purposes that each supervisor may establish to really continue to build upon the community aspect of our culture. And we could definitely unpack that further as we move through process, but just wanted to, again, continue to share with folks the importance of that face-to-face contact post-COVID within 4,700, even as we move to a more remote work approach.
Thank you, Marco. And as also a reminder, tomorrow we're having a town hall, and during that town hall, it's primarily dedicated to providing an update as well as the framing, as well as a space for questions regarding the admin move process. So just wanted to remind everyone that that is scheduled for tomorrow, and that will be a chance for additional questions and answers. It appears that we have a statement within the chat that I'm going to present, and I'm thinking perhaps June could respond to this or provide some clarity or additional information. It states that the physical symptom list includes everything now, all the symptoms of allergies per se. June, are you in a position to talk to a physical symptom list that we have and the context for that? We can unmute June.
Yes, we did update our COVID-19 protocol list with the various symptoms, including the last symptom that I spoke to everyone about in, I believe, our last town hall, which was the different types of rashes that sometimes accompany a viral infection. Not in everybody, but it does happen. So, yeah. If you have a lot of allergies, but you're not sure, the best thing to do would be to go to your primary care doctor and get tested. That would be a confirmation that your symptoms are just allergies. It's always best to take the most conservative measure and to say, well, geez, you know, I don't have a fever right now, but I've got all these other things, so maybe I shouldn't go to work today, and talk with my primary care physician about, you know, do I potentially have COVID? That would clear things up. You can do that even on telehealth. That's available with most physicians. I think all of them are doing that now. So yeah, rather safe than sorry. And if you need the symptoms, you can certainly go to our COVID-19 protocol document and see them there.
Thank you, June. This is a question regarding the ACT team. On an ACT team, only working from home is not possible. We are in the community and office each day. Can you confirm that the expectation is, if something is possible via telehealth, ensuring the safety of the client, we can do telehealth? Face-to-face will only occur when necessary.
So Sean, I can jump in and respond to
Yes,
that with
thank you,
Linda
Bernie.
and I think Sandy out. I would say that, yes, you know, as long as the pandemic conditions exist, safety is always going to be our main concern. With mobile services, anything we can do through telehealth, that is what we need to do. There are always going to be those one-offs where we need to do face-to-face, we need to do medication drops or things like that. But anytime telehealth is possible, that still should be the rule of thumb. Having given that answer, I would also ask whoever's posing that question to check with your immediate supervisor and Linda or Sandy upon their return tomorrow. But that is my impression.
Thank you, Bernie. There was a question regarding clarity for the Admin Space Initiative Town Hall meeting tomorrow. That meeting is scheduled from 3 to 4:30 Eastern Time. I believe there was a communication that went out, and we can also send out an additional communication as a friendly reminder. But the question was regarding the time for the Town Hall tomorrow. That's 3 to 4:30, and that's going to be a Zoom call. And my question, and it's regarding testing. Some of us would be getting tested daily due to allergies that have existed long before COVID. That's not realistic. I guess that's more like a statement or a reflection.
Sean, it looks
Go
like
ahead.
June would like to
Yeah,
respond.
Yes, Jen.
so maybe someone misheard me. Getting tested just to see if the conditions that you have would be a one-time snapshot of what you're experiencing. You wouldn't do that daily. I mean, if you continue to have the symptoms up until your test came back, if you tested negative, then your symptoms you could roll out with your primary care physician's advice, whether it is COVID or it is allergies. Hope that clarifies.
Thank you, Jen. And I'm looking, and there appears to be another question. Just familiarizing myself with the question before posing it. Yes. So this is a question to June. Is there or will there be an expanded version of the temperature and symptom log that reflects some or more symptoms as you described? Right now, it is still temperature, chills, cough, shortness of breath. Yes, Jen. Oh, and unmute Jen.
We did update as of 7/23 the COVID-19 law protocols on that are posted. I can certainly send a copy directly to you, but all of the symptoms, and there's a long list now, from nausea to other things which I don't want to mention, but anyway, it's all been updated. It's a full comprehensive list, and so that's currently available for your review.
Thank you, Jen. I'm just checking the chat to see if there's any additional questions that have come through. And I'm going to check with my colleague. Sarah, just wanted to check to verify if there's any other questions that have come in through any other medium. Great, thank you, Sarah. So as it appears there are no additional questions at this time, I'm just going to wrap up before passing back to Marco for closing. Okay, there appears to be a follow-up question to June, identifying that the question that was asked wasn't fully answered. Does it need to be on the daily log for staff? And we can unmute June so that she can respond.
I would certainly, I'm not too sure. If you could send me your log that you're referring to, I can look at it. The general symptoms, you would express that, do you have any of these symptoms? Yeah, so if you need to have a script of what they are, certainly add it to your log, or you can post it right near your log so you remember to ask all those things.
Great. Thank you, June. Let's check in to see if there's any additional questions. And I have two closing comments before passing the mic back to Marco, who will provide us with our closing remarks. One is an observation. It appears that as we continue to have a variety of initiatives and work that we're doing with an organization, it increases the number of questions that people might have. As an organization, we're working really hard to get out communications through updates and announcements. And I think that this forum is also helpful because based on the questions today, there are times when you read something, you want additional information or you can't read behind the scenes of what was communicated. So it sounds like this forum is helpful. I want to thank you for your questions and your probing because that is, like, I think, an indication that you want to do the right thing. You want to have information so that you can move forward and continue to do your work. So just an observation that we had lots of different questions, and I trust that that was helpful for you in clarifying what you need to be able to do your job. And then my second observation, or just an announcement, I realized that there was not as seamless as I would like to have this to been as the host for this feature. I am aware of like where I may have dropped the ball, and just wanted to let you know I'm working on that and going to ensure that this gets a little bit more seamless as it relates to the questions in the chat and just the navigating and toggling. But just wanted to let you know that I'm aware that it probably wasn't as seamless as I would like to have been. And so just want to let you know that I'll work with my colleague Sarah and we'll get this thing rocking and rolling so it's just like flawless. With that said, I'm going to pass the mic back to Marco, who will provide our closing remarks. And before I do that, there's an announcement from Stacy. There's a reminder about the virtual LDP graduation this Thursday, which is going to be from 2:30 to 4:30, and that's going to be via Zoom. All are invited to join, and an email reminder with connection information will be sent later today. Thank you, Stacy. And with that, I'll pass it to Marco. Marco.
So first, Sean, you do not give yourself enough credit for trying to managing this call. So a round of applause for Sean and all that he has done and continues to do to help us manage this at times, very complex dialogue that we have about all the things that are going on within RHD. So no worries, Sean, you did great. You did great. I do want to echo some of what Sean shared in terms of, again, a great forum for all of us to use our voice to really share and surface ideas, concerns, observations, and points of conversation that will allow us to move forward successfully as an organization. So I thank everyone who used your voice today to share your thoughts, your ideas, to ask the questions asked, and I appreciate all that we're able and ready to respond to those questions as well throughout the call. Again, we have our Admin Space Initiative Town Hall tomorrow at 3 o'clock. So please join us then for some further dialogue around our admin space. We have our LDP graduation as Sean shared on Thursday. So please make room on your calendars to really help us celebrate all the hard work of our graduates. And the last thing to remind you all is look out in your email, hopefully during the rest of this week, for some communication relating to our new rejuvenated values that I'm super excited to begin to share, that we are super excited to begin to share with all of you within our community. So stay tuned and thank you all for joining.